Health Minister Dr. Joe Phaahla has briefed the Oversight Committee on the proposed revised regulations. He says Friday's deadline for public comment will be extended by another week. This after 150,000 public comments were received so far. Since COVID-19 infections have been declining, government has decided to lift the state of national disaster and use the Health Act to manage the pandemic.
The fear that in terms of this regulation, some of the measures looks like can go on forever. We want to dispel that myth also that is definitely not the case.
If you are suspected to have COVID-19, you cannot refuse to be tested, and those who are infected must self-quarantine at home. Masks will be mandatory indoors and in public transport. Those entering the country will require a vaccination certificate or a PCR test within 72 hours of entry. Funerals will be limited to 100 people, and gatherings must be limited to 50% of the venue capacity. Indoor gatherings are kept at 100 people, while outdoors a maximum of 2,000 people are allowed. Warrants of arrests can be issued to healthcare workers who refuse to be tested, but they are allowed legal representation. However, some parties are not convinced by the proposed regulations.
There is absolutely no point in making changes to an act that cannot be implemented. And I don't see how you can implement this. I really do not see how you can implement this.
This is a mere way of allowing the government to continue with strenuous economic restrictions. I mean, only the minister will have permanent power to lock down the country as well, and as well force the COVID-19 vaccination.
Your department, through draconian intervention, want to just implement these things without proper consultation.
These regulations are extremely important. There must be, every single country must have in place regulations to manage notifiable diseases.
Meanwhile, the health minister has dismissed accusations that the revised regulations are draconian.
The notion that this is draconian, I don't know what really constitutes draconian. In terms of wearing of masks, in terms of making sure that people don't gather in big crowds without social distancing, and also making sure that when that happens, it must be with particular protection, including vaccination, and also making sure that when people come into the country, they must also be protected in terms of vaccination. I don't know. If you regard this as draconian, then I don't know really to you what would be any public health measure. And that would be interesting for me to know, for us to know what would constitute public health protection.
The public has until next week Friday to comment on the revised regulations. Ulelani Philip, SABC News, Parliament.